So this is a new syndrome that the CDC has most recently defined about a few weeks ago very broadly as being a disorder of children with lab evidence of inflammation, severe illness requiring hospitalization, with multi-system, at least 2 organ involvement. And the organs cited are the skin, but also cardiac, renal, respiratory, hematologic, GI, and neurologic. So these patients actually don't often have the respiratory changes that we think about in adults with COVID-19 infection. They can be put on ventilators, but it's usually because of the need for cardiovascular support. They go into shock. They have issues, of course, with cardiac function, as mentioned. So these children have fever. They have evidence of inflammation, including laboratory evidence of inflammation, with no alternative plausible diagnosis. And you have to have some evidence of having the infection. That could be PCR that's positive for the SARS-CoV-2. It could be serology or even an antigen test, or it could be exposure to COVID-19 in the 4 weeks before symptom onset. In the last month, we've been seeing a frightening new development regarding COVID-19 and children. It's been called multisystem inflammatory syndrome in children. It was originally described in the end of April, coming out of the United Kingdom, and subsequently started to appear in early May in New York City. Initially described May 4th in 15 children between the ages of 2 and 15 who had, in just the previous 2 weeks, come in with fever, often shock, gastrointestinal issues, and not infrequently a rash. And this was the first time that we had really had dermatologic issues as part of what we've been seeing in children, even though there had been some descriptions certainly coming out of China and Europe. On May 13th, there was a new report that came out from Italy describing many of these children and describing how what was seen could be very similar to Kawasaki disease, a disorder we know well in children. And on that same day, the New York Department of Health had issued an advisory that more than 100 children in New York had this multisystem inflammatory syndrome, with 3 deaths already. Since that time, we've seen many more in New York, and we've certainly started to see this pop up in many other states here, as well as large numbers now in Europe. This is a syndrome that in some ways resembles Kawasaki disease, and I remind you that the children with Kawasaki disease tend to be very young. We see this more in those of Asian descent, and they have high fevers for several days in a row, plus at least a variety of features, including bilateral conjunctivitis, redness, and even fissuring of the lips and mouth. They can have peripheral edema of the hands and feet that is also associated with redness and later desquamation. And they often have adenopathy, particularly cervical adenopathy. And then what we often see as dermatologists, what's been called a polymorphous rash, because it can take on so many different forms, but often looks like erythema multiforme. And indeed, in the series that came out of the UK, about half of the children had a rash, but it wasn't really otherwise described. However, the series that came out from Bergamo, Italy, described 10 children who came in with what looked like either classical or what's been called a typical Kawasaki, in which there aren't quite enough features to call it classical, but the features are there. And this group found these 10 children just between the middle of February and the middle of April. In comparison, in the previous more than 5 years, they had only had 19 cases of Kawasaki disease.